Thank you very much. His Excellency the Governor, I cannot thank you enough for giving us the opportunity to do this with and for Mandera. Next month will be the 50th year since I entered the medical school, University of Nairobi, in 1973. So 50 years later, having seen what's happening here, having worked across the World Bank and everywhere else, I can tell you with confidence that the report we are giving you is a standard report that you can take anywhere in the world and it will be approved. But first of all, let's remove some myths. There's a myth that Mandera is an unsafe and insecure place. This is wrong. Only one county in Mandera, Lafe, is insecure. Sub-county. The rest of them are as secure as Siaya. But because we want to use that word insecurity, it has made it possible for health workers to be absent from work, for health managers to be unaccountable because of insecurity. This is hurting us. Maybe you are enjoying being called insecure, but it's time that you made the rest of the country know that the whole county is not insecure. Secondly, the myth that Mandera is poor. Mandera is not poor. And we have looked at that in terms of NHIF coverage. And we see clearly that at 1 goat per year, every household in Mandera can be on NHIF. 1 goat. As we came from the airport, I was counting the number of goats that were roaming by the road. And I've also been following the news on the number of goats that died during drought. And I can assure you that had those goats been taken to KMC, to Nairobi, everybody in Mandera would be under NHIF with no extra need from anywhere else. So you can do it, but do it imaginatively. 4 lessons. Number 1, you are not going to go anywhere unless you focus on primary health care. Prevent, prevent, prevent. Your focus on facilities, I can understand from where you came from, but that is pure hardware. The facilities must work. So the software needs to be done there. So you have to turn your budget around with the support of the politicians so that we go to prevention mode and limit the number of people who require hospitals and referrals. Right now, your expenditure and effort in that area is null. You can build as many hospitals as you want, but your people will not be healthier. 2 is on governance. So, when you ask me to lead this team, I ask you one thing only. Number 1, will you implement the recommendations? And number 2, will you give me honest people? The health sector in Africa suffers not because there is no money, but because it is filled with dishonest men and women. If you want to change this, bring people who have missionary zeal in this sector, who see every sick child as their child, every sick woman as their sister, every old man as their father. We cannot continue being rich on the back of sick people. And this will mean that you need the support of all your people here so that they don't ask you to employ relatives. Put people because they're skilled, they are determined to make a difference, and Mandera will change within 1 year. So governance then becomes an important part of the start of this journey, that you will be different, you will be accountable, and you will be answerable to the people. And unfortunately or fortunately, we realize that being a Muslim society, you have already made audience through the mosques. The mosque can be a discussion point, a reporting point in what's happening in the next health center. The mosque can be a discussion area for the health management teams that are supposed to deliver in that area. Let us use this even as the area for mobilizing people for NHIF. Because if a mosque has people who are not on NHIF, then there are people who are going to give you problems. Let's use it this time for the health of our people. Comes the area of infrastructure. We saw it today, and Madam Waziri, you are asking common sense questions. We do agree that Mandera was left behind the rest of the country, and you need infrastructure. But the most important thing is that it is not just the brick and mortar or the machines, it is the services that they offer. So unfinished facilities are an unnecessary burden on the people. So let us put a moratorium on building new ones. My dear MPs, please, I plead with you. I know that it drives votes when a new one is started and a foundation is built. But that foundation is not healthcare. Let us finish the ones that we have. We have already calculated that if all your facilities that you have already started structuring were finished, you would immediately qualify in the WHO definition of adequate primary healthcare facilities because they are within 5 kilometers of everybody. Just finish them and let them work. The same thing goes with the machinery, the labs, and everything else. You'll be surprised that the only fully functioning equipment, imaging equipment in Mandera is a CT scan. And the CT scan was bought through the medical equipment scheme that guarantees its functionality and its service. The rest of them that you have bought are down and doing nothing. So they are not serving the people of Mandera. So the equipment maintenance in modern health starts with procurement. It is not a question of employing engineers and technicians, because the modern equipment do not require a nyundo and a spanner and a pliers. It is electronic. So when I went to your biomedical unit, I said, close this place immediately because it can only spoil your machines. Your purchase must guarantee service of that machine. So buy service. Stop buying hardware. Buy the service so that it works, and you will be surprised at what changes. In the area of human resource, it has been said to you, we saw it everywhere, and you know it. There's too much of people who are employed not because they deliver, but because they know so and so. This is an African problem. But Mandera, for goodness sake, stop being African for once and just put the right people to do things. When you refer yourself to India to go and be treated there, you don't look for your relative there. Anybody qualified will treat you. So how come when you're home here, you want your relative who will kill you to be the one who is employed without qualification? So let's change this thing, because it's a culture that is killing us, killing our people, killing our children. And that is where human resources is. Madam Waziri, you asked about specialists. And we were told that they've been advertising and nobody comes. Yes, nobody will come. But we need innovative approach to this. Consultants don't have to be employed on a full-time salary, housing, and everything when they sit here for only 1 week and then they are away. Contract groups of consultants, 6 gynecologists covering here. Each month, one of them is here. That group contract will give you more than putting somebody here on pension and everything else, and yet they don't come to work. So change this. So consultants go on contract and save some money to pay the nurse and the medical officer and the clinician better. Right now you're paying people who come and go. If you work with the public-private sector, you'll be surprised at how easy it is to have consultancy coverage here. I'll give you an example. Right now, all your orthopedic patients go across the border to Ethiopia. But where do they go to? To a mission hospital. They don't go to a public hospital because that mission hospital has kept somebody there. Why can't you have a mission or a private hospital keeping somebody here and you arrange so that they cover both public and private at an agreed rate? Those things can be done. And finally, 2 areas. Pharmaceuticals, you had it. 700% higher purchase. Do you think that you can buy enough medicines for the people of Mandera? Absolutely none. And why is it that KEMSA is not giving you? It's not just because of KEMSA. You always send your request late or you send too small so that an opportunity comes for emergency purchase at 700%. So these are things that we must do and do correct for our people. This is not about me or you. It is about our people. IT and information. You saw the title of this document. It is Identify, Reach, and Serve with Dignity. It's only in Africa where we never make an effort to identify our people and our patients. We always work on estimates of people. The mosque knows their numbers, but the health sector doesn't know. They know the people who die and we bury them, but the health sector doesn't know. It is time now where Kenya is moving that we know every household under that mosque. And that household has a number, has a name, and it can be reached. Once you reach it, you can provide service for it. Once you provide service for it, you can bring in the result framework that shows whether they were immunized, they were fed, they were given the injection. That requires that we use IT. Now, there is not a single health facility that has functional IT system in Mandera. And yet, when I go to Nairobi, around Jamia Mosque, all the computers there are owned by people from Mandera. So how come you can stock this thing in your shops in Nairobi, but you can't bring them to your hospitals here? I believe we can, I believe we must, and that is why my team is proud to give you a report that has all the details and all the evidence of the things that we have summarized. We appreciate you and we are honored by the opportunity to do this. Thank you very much.
Let's recognize the efforts of the task force. I know Prof is a lecturer. He can stand and give us help the whole day without us getting bored. And may I now request the entire audience to appreciate what has been done by this task force. I think that is kidogo sana. Can we give them a kilo clap? Thank you very much. Thank you very much.